home and protect lives. That's the clear warning from the Health Secretary, Matt Hancock, who says it's not a request, but an instruction to the British people to beat the coronavirus. With warm weather expected this weekend, he says any relaxation of social distancing rules will mean more people will die. In the UK, the number of dead has risen by 684 in one 24-hour period. That brings the total number of deaths in hospitals from the disease to 3,605. Now that number, however, doesn't include deaths in the community or in care homes and is in line, sadly, with scientific predictions. Today, 2 nurses lost their lives to the virus, with each leaving behind 3 children. Here's our health editor, Hugh Pym.
Amy O'Rourke, one of 2 nurses who've lost their lives to COVID-19. Tributes were paid today to their bravery, including at the Downing Street press conference, and there was this warning to the public from the Health Secretary.
We cannot relax our discipline now. If we do, people will die. So I end with the advice that we all know. This advice is not a request. It is an instruction. Stay at home, protect lives, and then you will be doing your part.
Nikki Fox. Now, the World Bank has pledged $1 billion to India to help tackle the coronavirus pandemic there. More than 2,500 infections have now been confirmed in the country, and more than 70 people are now known to have died. The city of Mumbai has some of the highest numbers of patients in India, with many living in congested slums, sparking fears the virus could rapidly spread further. Yogita Lemai has more details.
The virus has reached here, Asia's biggest slum and the most densely populated area on Earth, Dharavi. Nearly 1 million people live in less than a square mile. Social distancing is next to impossible.
People are extremely scared here. If Italy's healthcare system, which is ranked 2nd in the world, couldn't cope, India is far behind them.
Here in Dharavi, as well as in other slums of the city, people have tested positive for coronavirus. Once that happens, they usually try to seal the area and then go door to door to check who else might be infected. But you can imagine the challenge the government faces trying to trace the spread of the infection in cramped spaces like these. The number of cases are doubling every 3 days now. The healthcare system is already struggling. A doctor treating COVID patients at a hospital that caters to at least 3 million people described the condition there. Fearful of speaking out, she didn't want her face to be shown.
We are totally unprepared. In our institute, there are only 6 ventilators. So we have been finding ways where we can use 1 ventilator for 2 patients. It's very scary. All of us are just really overworked. There are so many places, rural setups, which lack basic healthcare facilities. They have no hospital, they have no doctors working there. And I think they are going to be hit the worst by this illness.
India's spending on healthcare is among the lowest in the world. A doctor here treats 4 times as many patients as one in the UK. And India has less than 11 ventilators per million people to treat COVID patients. If the virus is a threat, so is the stigma of contracting it. In the city of Indore, healthcare workers were attacked for trying to screen a woman. This stadium is being converted into an isolation centre, as are train coaches, today lying empty. The railways were shut down nearly 2 weeks ago, as was the rest of India. It took months for coronavirus to affect 1 million people around the world. If not contained in a country the size of India, that number could multiply very quickly. Yogita Lemai, BBC News, Mumbai.
There are now more than 1 million confirmed cases of coronavirus in 181 countries, with Europe still the epicenter of the outbreak. Italy, with more than 14,000 dead, is the worst affected, but the daily mortality rate is coming down. Spain comes next, but it does have the highest number of confirmed coronavirus cases anywhere in Europe. And in France, the number of dead continues to rise, with deaths in care homes now being included in the figures. In Paris, police are strictly enforcing the government's tough quarantine measures over the Easter holidays. Railway stations, airports and major roads will be monitored to prevent people leaving the city. Lucy Williamson has more details.
It's not only nations that thrive on liberty, epidemics too. At stations across Paris today, every journey began with a police check. Freedom of movement, a new national threat. Do you have your piece of paper?
Of course. Yeah.
Johan made it through. He's on his way home to Brittany after 2 years abroad. But even the smallest mistake means being turned away.
I wrote the wrong date, not today's date, and they've told me I need to go back home to prepare another form. I have to go to work, but I can't.
France carried out almost 6 million checks during the first fortnight of confinement, far more than neighbouring Italy, and it's issued more than 400,000 fines. But questions over when the confinement will end are growing.
France's tough approach to the confinement runs the risk of losing public support if it becomes too harsh or too long. The Interior Minister has advised sensitivity in applying the rules and says the police operate differently in the countryside compared to the big cities in the poorer suburbs.